Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello, welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. Today we're going to focus on sports medicine. My guest today is Dr. Kevin Cipriano, a specialist in sports medicine as well as physical medicine and rehabilitation. He completed his residency in physical medicine and rehabilitation at the MedStar Georgetown National Rehabilitation Hospital Program, where he served as chief resident. He then went on to subspecialize in sports medicine at Emory University as a team physician for local high schools, the Division I Georgia Tech and Division III Emory University athletic programs, as well as Atlanta Falcons, Atlanta Hawks, Atlanta Braves, and Atlanta Dream. He is currently a physician at Long Island Jewish, Forest Hills, part of Northwell Health. Dr. Cipriano, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Great. Appreciate you having me here today. Thank you.
You have been busy, I'm hearing.
Yeah, a long couple of years of training, but it's nice to be settled in and doing what I love.
Tell us, with this impressive resume, working for all of these different colleges and professional teams, what made you want to decide and focus on sports medicine in particular?
Yeah, honestly, it was something that I've had a passion for since I was pretty young. I knew going into medical school that sports medicine was my goal and what I wanted to do. Yeah. I was lucky enough to make that a reality. For me, I was an athlete myself. I'm someone who's very active and very involved in, health overall, with nutrition, with being active, cardiovascular fitness and activity. And so I was really passionate about those subjects. I really love working with those types of patients too, people who are motivated, who want to get out there and be active. And sometimes they have these hiccups where they have these injuries or different chronic issues going on. And to be able to be a coach and help them through that is really, really helpful and has been very rewarding. I definitely see a good spread of patients from your typical, younger athletes to the weekend warriors, as well as some older patients as well with more degenerative diseases, things like arthritis in their knees and shoulders and things like that. So it's nice to be able to educate and help, a wide variety of patients.
So you are a physician who specializes in sports medicine. Tell me the educational process for you becoming a sports medicine physician.
Sure. Yeah. So you start off with your undergraduate degree, so 4 years, and you do all the prerequisites you need to get into medical school. Medical school is then 4 years. So after that, you apply for what's called the match program. So you look into your primary residency. So the main doctor you're going to be. People know that as like an internist or a family medicine doctor, a neurologist, things like that. There are many different ways to get into sports medicine, but it is a subspecialty field. So you can either do the surgical route and do orthopedic surgery, and then do more of the surgical side of sports medicine. The other side is the non-surgical side. And, about 80% of injuries and sports-related issues are non-surgical. So a lot of that comes into our realm. So the majority of doctors who are in sports medicine on the non-surgical side do family medicine, like your primary care doctors who do a year subspecializing in sports medicine. But there are actually many routes to go about doing it. I did what's called physical medicine and rehabilitation as my primary specialty in medicine. It's called PM&R, or physiatry is what it's known as. And we treat the whole body, and the functionality of the body. So we have a very wide variety of treatments and patients that we see, anywhere from brain injuries and spinal cord injuries to hip replacement surgeries, to amputations, as well as more of the outpatient side of things with sports medicine and pain medicine as well.
So it doesn't necessarily mean because it's sports medicine that it's tied to a sport per se.
Correct. It's a common misconception. Really, you're working in a clinic just like any other doctor on your 9 to 5 hours. but typically you're affiliated with different high schools, local, college, professional, what have you, different teams, different events like different Ironmans and marathons, all that stuff you kind of do on the outside of clinic. So kind of what I call our on-call time is covering these games, these sporting events, seeing athletes after hours, either in a training room or actually being on the sideline during their events.
So I guess you would be the one, if there was an Olympic game, you would be on the sideline in preparation for treating these athletes who are, in these competitive sports. Is that the way?
Yes. Mm-hmm. Yeah, that's actually one of my main goals is to work with the Olympics, and they're coming here in LA in a couple of years. So something I'm applying for. One of my mentors at Emory actually is the head USA track and field doctor. So he actually got to work closely with Noah Lyles.
Oh, wow.
Was on TV and everything when all those episodes were occurring. So we're right there, right on the sidelines, from anywhere from a local high school team to as high level as, the Olympics.
That's awesome. So, what is the most common injuries you treat when it comes down to athletes?
Yeah, so I would probably say the two joints that are injured most often are the knee and the shoulder. I'd say with the ankle kind of being a close third. A lot of injuries I see are different sprains and strains, things like a hamstring strain, Achilles tendonitis, to the more severe issues like an ACL tear or an Achilles tear. I do also see a fair amount of sprains to the shoulder. You hear about people separating their shoulder or dislocating their shoulder, or just having some tendonitis and bursitis. So it's kind of a mixed bag, but those are probably the most common that I see.
Are you seeing a lot of concussions as you're caring for athletes?
That's a good question. Yes, that is definitely another bucket of patients that I see as well. We typically treat the sports-related concussions, which has definitely become much more prevalent in terms of in the national media these days. So getting the proper care for those patients is paramount. So we work closely with the local middle schools and high schools, and Northwell is an expansive territory that they take care of. So pretty much any high school athlete who has signs of a concussion is evaluated by our athletic trainers on the sideline, or if there is a doctor on the sideline for that game. And then they're always followed up closely on Monday or Tuesday in clinic for further evaluation as well.
Now, are there certain sports that have more of a higher risk, if you will, for injury? And I would imagine the contact sports, but then I'm looking at these gymnasts. They really pose probably a lot of risk to the joints as well.
Yes. I think lumping them together into two different categories, like you said, the contact sports, obviously football is a very intense contact sport. Things that aren't as popular in America, things like rugby, very contact sport heavy, those types of things have a lot of injuries.
Hockey is a big one.
Hockey's up there for sure. Stuff you might not think about too. Basketball and soccer have a lot of non-contact injuries that we deal with. And to your point, more of the people who are hyper specialized in things like gymnasts, people who are rowers, or track and field, those very specific activities that they're doing can lead to a lot of overuse injuries where you're putting so much strain and pressure through a joint or a tendon or muscle, as well as the risk for, as a gymnast or one of those, you could have a fall from a height, onto your wrist or your hand and have a more traumatic injury as well. So it's definitely a mixed bag.
So I know prevention is key, but I know with the mouthpieces and the knee braces and, all the pads that are used, still you sustain injury. What is the biggest way we can prevent injury when you are an athlete? Yeah,
that's a great question as well. I tell people what you want to make sure is that you have a really good off-season training program, meaning that you're building up your activity slowly and gradually and progressing as accurately as you can. So I tell people to try, teams are doing this where they're tracking the amount of minutes and hours that athletes are on the field, tracking exactly how much weight they're lifting and doing specific exercise routines in the preseason. And I tell people as you slowly and gradually increase, you're at less and less of a risk of injury. A lot of times the injuries come when people are rushed back too quickly or they don't have the proper strength and control of their muscles and balance. something we call proprioception, working on a lot of balance exercises, being very mobile, working on stretching in the appropriate times, as well as that strengthening exercise to be able to control your joints as you move them around in these complex patterns for sport is the best way to prevent injury. Obviously, it's impossible to prevent all injury, and some are more freak accidents than others, but that gives you the best chance for your body to be as resilient as possible.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're talking about sports medicine and rehabbing from sports-related injuries. My guest today is Dr. Kevin Cipriano, a specialist in sports medicine as well as a physical medicine and rehabilitation at Long Island Jewish Forest Hills, part of Northwell Health. He has also been a team physician with the Division I Georgia Tech and Division III Emory University athletic programs, as well as Atlanta Falcons, Atlanta Hawks, Atlanta Braves, and Atlanta Dream. So can you walk us through, we talked about these injuries that can occur with athletes. So because you're not on the surgical end of things, what do you primarily do once an injury has happened?
So we're mostly in the business of diagnosing and then starting the conservative management, as well as figuring out what needs to be seen more urgently. So say someone has an ankle sprain or they hurt their ankle at practice. So we're out there on the sideline with the trainers evaluating exactly what injury occurred, trying to figure out, is this just your run-of-the-mill common ankle sprain, or are they tender over certain areas where, over the bones where, okay, this is something we know needs to get an x-ray. So, we have them come into clinic, we get the x-ray, we make sure there's no fracture, nothing's dislocated, and then we get them on the treatment plan in terms of specific braces that they might need to wear, get them set up with physical therapy, and monitor their recovery. Also, in that standpoint, let's say there is a more severe injury and we get imaging and there is a displaced fracture or a non-displaced fracture, we can figure out, is that something we can splint and manage non-surgically, or do they need a more urgent referral to a surgeon? Maybe they have a dislocation of a joint. We can get MRIs done and refer it out to the surgeon for that as well. So there's definitely a large continuum from this standpoint, and we're kind of the front lines, almost like the primary care side of the musculoskeletal injuries.
So what does the rehabilitation process look like once the injury has been sustained? And where does it occur? Is it in the home? Is it on the outpatient basis? Where is it?
Yeah, so that depends on the injury. If it is something that's deemed non-surgical, usually they'll see me in clinic and I'll give them a referral to physical therapy, where we have many locations around the area. I also have home exercise sheets for specific injuries that I tell people to get started on right away that can be very helpful. What people used to think of as the kind of the gold standard of treating these issues was, people probably have heard of the RICE method. So rest, ice, compress, elevate. For most things, it actually is a little bit outdated. And for the first 2, 3, 4, 5 days, it's okay to rest. You do want to keep things elevated and compressed. Ice doesn't help as much with inflammation as we might have thought, but it can help with pain control. So we usually recommend that as well. And then we actually try to get people moving and loading the joints and tendons earlier than later. So people used to think you had to rest and keep it immobilized for a long period of time. But we've actually found that people, the healing process is improved with good circulation, good blood flow, getting range of motion to the joint, putting pressure and loading it appropriately. So we try to load the joint appropriately within the first 5 to 7 days. And that's when they'll start the rehabilitation process. Depending on how severe the injury is, they'll go to PT at a location 1 to 3 times a week for usually an average of 4 to 6 to 8 to 12 weeks, depending again on the injury. And during that time, they're monitoring in office here with me as the doctor to make sure they're progressing appropriately. And if not, knowing how to diagnose what might be going on and get them the appropriate care.
So if someone sustains, for example, an ACL tear or some issue like that, you really want them on their feet as early as possible, maybe sometimes a day or two after the actual injury, just to keep them moving. Is that the way you're thinking?
Yeah, and I'll kind of break it down into 2 examples. So for an ankle sprain, that's okay to rest for 2, 3, 4 days. But after that, you really want to try and test it out, obviously don't do too much. I tell people, let your body be your guide. A 3 out of 10 pain, some mild discomfort is okay. If you're walking on it and you're getting 8 out of 10 sharp pain, you're probably doing a little too much. And that's why I like people to be guided with the physical therapist, so they're having that appropriate guidance on how to use and move the joint as early and safely as possible. With something more significant like an ACL tear, a lot of times that may be diagnosed in the emergency room versus, if it's with a sport, they may get into my clinic sooner than later. Initially, a lot of times they'll be put in a knee immobilizer. So they're kind of walking with a peg leg with a giant brace on. Once I get them in office and I can confirm that most likely they have an ACL tear, they usually have a lot of swelling inside of their knee. One thing we found is very helpful, and another thing that I add from the non-surgical standpoint is if they do have a large effusion, we call it, or swelling in their knee, I have an ultrasound or sonogram machine in my office where I can look at that swelling in the knee and actually numb the knee up and drain that fluid out. Okay. And that's actually really helpful because it helps with pain relief in the knee, as well as helps them get back to their normal range of motion and function, because most of these people will need surgery, and surgeons won't operate, for the best outcomes. They need to wait until they have full extension and flexion range of motion back in their knee before they're a candidate for surgery. So getting that process started as soon as possible makes for the best outcomes.
What about those athletes that emotionally and psychologically, really having this anticipatory pain upon movement, and they just don't trust the knee or leg or whatever that joint is anymore, and you have to really say, okay, you can trust the knee, stand on it, put more weight on it, it's okay, you're going to be all right. How do you manage that? Yeah,
a lot of it is more mental than people realize on both ends of the spectrum. So on the initial diagnosis, this can be a devastating injury, psychologically for people. It's their senior year of high school or college. They don't think they're ever going to play this sport again. And you're telling them they might be out for the season. They might never play that level ever again. So I think having the appropriate compassion initially is very important. And then on the flip side, for people who say, they have a lot of years ahead of them and they're trying to rehab back to their former level of play, a lot of it is saying, listen, this is a long time frame. You got to treat this as a marathon, not a sprint. This is going to take maybe 6 to 9 months to fully get better. And, setting up realistic expectations, coaching them through the day to day. And then when they are close to getting back to normal, having that confidence, like you mentioned, saying, okay, you've done all the appropriate treatment. You've worked really hard up until this point. Structurally, everything looks okay. You're okay to test that knee, test that ankle, that leg, and just giving them that positive reassurance, I think, goes a long way.
So that sounds like that's at that point where they really are ready to get back to their athletic, whatever it is, as a football player, gymnast, or whatever it is that they do. Are you there at that point, watching them perform after the injury, or are you really asking them to report back to you how they do, or how far do you go?
Yeah, it depends on the patient or the athlete you're working with. If, say, I'm one of the head team doctors for that high school or that college or professional team, likely I'm going to games multiple times a year throughout, multiple years. So I get to witness them, returning to play and seeing them get back to activity. But their day-to-day is working with their athletic trainer as well as a physical therapist that's seeing, they're spending an hour of dedicated time with them, analyzing all the details of their strength, their output, their range of motion, their ability to cut or to perform their specific sport-related activity. So they're really working side by side. And if there's ever a question or concern for the doctor, they'll give me a call. They'll come in for a visit, or I'll get to see them at a game when I'm covering the sideline for another game down the line.
I'm just turning the page a little bit. Are there any new or emerging treatments in sports medicine that are particularly promising that you have used, or that looks like it's coming over the horizon somewhere? Yeah.
Sure. There are definitely, sports medicine is a booming industry, and everyone is more active these days, and everyone's looking back to get back from injury as fast as possible. So as you can imagine, there's a lot out there. I caution some people, sometimes some people who are trying to sell you something that may be too good to be true. There are a couple of things that are in rigorous research right now that are on the horizon. One of the biggest topics in sports medicine, and it's been around for about 15 years or maybe longer at this point, but still is an emerging topic, is something called PRP, or platelet-rich plasma. So when you have a tear in your muscle or your tendon, or older people who have arthritis in their joints, what you can do for those treatments is to you actually draw blood like you're giving blood. You spin it down in a centrifuge machine to concentrate just a little bit of the blood where the plasma is, and that has all these healing growth factors. And then we use the ultrasound machine to guide an injection of those healing growth factors back into a tear in a tendon or a muscle or things like that, to help promote appropriate healing and recovery, and hopefully get people back as soon as they can. It's not a quick fix, but it hopefully readies people for the best they can be. And it takes about 2 to 3 months for recovery. So that's one of the big emerging topics right now.
That sounds promising. Is that something that is done now?
So, yeah, I do it in my office. I do it for athletes and weekend warriors and people with arthritis and degenerative tendons alike. It has fairly good research these days. It just hasn't gotten pushed over to the edge yet to be covered by insurance yet. So that's one of the big hurdles, is it's still an out-of-pocket expense for people. But it is definitely a really good emerging topic. That one, you have to sit out a bit after you do the procedure. There is another emerging topic called shockwave therapy, which actually was initially invented to pulverize kidney stones, which people probably are more aware of on that side of the medical spectrum. But they found that those pulse waves and that what we call mechanotransduction, so the actual physical pulse of that sound wave and shock wave that's hitting the tissue, can promote blood flow to the area and help with things like tendinitis and strains and sprains. And the good thing about that treatment is you don't have any downtime. So I have a lot of college athletes when I was training and professionals who would get that treatment done in the locker room or with physical therapy or in the office with us, with the physician, and play again the next day, and it kind of just helps them keep going. So I think that's another really promising aspect of sports medicine. That one's a little newer, probably in the last 5 to 10 years, and also is still an out-of-pocket expense.
So what do you think about some of the dietary supplements for athletes, particularly for their performance or recovery? Do you
Another great
them?
question. My biggest soapbox here is I tell people, and especially younger athletes and your everyday person, that 80% of what you're going to benefit from are the basic things. So making sure you're getting good restorative 8 hours of sleep. You're exercising 150 minutes a week of mild to moderate exercise, meaning brisk walking even counts for that, or biking or ellipticals, or you can do some vigorous exercise like running, sprinting, tennis, soccer, things like that, as well as eating a balanced diet, getting whole foods, whole grains, fruits, vegetables, a good amount of protein. And, if you're doing all of those things correctly, I tell people you don't really need that much in terms of supplements.
Okay.
The most well-studied supplements are things like caffeine, which people use all the time, which in moderation is safe and healthy and can help boost performance. Another is creatine that people use.
Right, I was going to ask you about that. Yeah.
Yeah, that's the most well-studied supplement that's out there for this type, for sports, related and dietary supplementation, and does have promising effects in terms of being able to get that extra rep or be a little stronger at the gym or help you with cardiovascular activity, and really doesn't have much side effects if you're taking the appropriate amount in. Doesn't really have any damaging side effects to any organs. So I really recommend the caffeine and creatine, as well as if people feel they're not getting enough protein from their diet, you can do protein shakes and protein powders. But everything past that, I tell people is, what do you want to spend your money on? Make sure it's safe. But a lot of supplements aren't well regulated. So I tell people to be very careful when it comes to supplements from that standpoint.
Are you seeing that a lot of athletes are using anabolic steroids?
It is something that I think comes up from time to time. Professional athletes and college athletes have such strict regulations that they're being tested for them frequently. So it's not something you see. But I feel like, unfortunately, in the general population, I feel it's become more prevalent and almost kind of more okayed by society, that people are are more even open, saying I'm using anabolic steroids, and maybe having some unrealistic goals and physiques attained by that those supplementations. And I tell people you really should only be taking any supplemental testosterone or that kind of thing or that nature if you have a diagnosed deficiency by a physician and it's medically necessary. And the side effects are not worth it, for any other person.
I know that vaping and smoking is really high and highly used. One of those recreational things that's going on now. How does that impact sports medicine?
Yeah, I mean, smoking definitely and vaping, they both lower your lung capacity. So if you want to be as optimal as possible with your activity, any amount of smoking is going to lower that ability for your lungs to function properly. Not to mention the significant risk in terms of different cancers that you can develop and just overall metabolic health. You also... whenever you have an injury, you don't heal as well. Even if you have a cut, it doesn't heal as well if you're a chronic smoker. Vaping is another issue too, where we found a lot of significant damage that can occur to the actual tissue of the lungs from vaping, even for a short period of time. So I tell people to try and avoid these at all costs. I know, especially with smoking, it's something that can be hard to quit, but you only have to quit once is what I tell people. So even if you're trying, it's always worth trying to quit. It's the number one positive benefit you can have on your health overall, probably more than anything I could tell people, is if you are a smoker, to quit smoking.
Give me your website and where we can find information about you.
Sure. If you are able to search my name and Northwell Health online, you'll be able to find my information. The specific website, if you go to northwell.edu/find-care and find a doctor, on that website you can search my name and there's an ability to make an appointment online there. I'm mainly located in Queens at 9525 Queens Boulevard on the 6th floor in Rego Park, and I'm there Monday through Friday.
Well, I have to say thank you. Very informative. Thank you for being here, Dr. Kevin Cipriano, a specialist in sports medicine, as well as a physician that deals in physical medicine and rehabilitation at Long Island Jewish Forest Hills, part of Northwell. We want to thank you for giving us this very important information going forward, and we thank you and hope you continue to stay healthy, and thanks for being here today with us.
Yeah, I really appreciate you having me. Thanks again.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.